This is the lower right, okay? So we've got an impacted wisdom tooth. We've got 231, 230, 229, 228. Okay, like this. So let's say that we're going to take out 230. So the general rule on full thickness mucoperiosteal flap is 2 papillae forward and 1 behind. Listen to me say this, okay? In dentoalveolar surgery, we do not use releasing incisions. It's a periodontal surgery approach. There are times to use releasing incisions. Come and get me, I'll show you. But I have students that took the perioral block, the first thing they do is drop a release. Don't do it. We're using envelope flaps here for dentoalveolar surgery. What's right here? The second premolar. You got the mental frame. I don't want you cutting that like that. And there are other vital structures. Now, let's say you're doing in the maxilla. So let's say that we're preparing this maxilla for a denture, right? And you're taking out the last molar here, right? And let's say the edentulous everywhere, and then there's some kind of snaggletooth carious thing here, right? And you're taking those last 2 out. So now you've got some significant buccal exostoses here. Mm-hmm. Okay? They're like tori, but they're on the buccal. So Dr. Hoover, Dr. Box, Dr. Eliason, any of those guys in the removable area are going to say, I need alveoloplasty. So what you're going to do in alveoloplasty is you're going to use wide vertical incisions where the apex is always greater. That's not right.
The base
is greater than the apex. I'm thinking apex of the tooth. So the base of your flap is always greater than the apex. Okay, and same down here. So if you had to do the same thing here, what are you going to do? Yeah, it's getting wider here and it's narrower up here. Why?
The
Blood supply. The blood supply needs to be robust to the flap. So in this case, yes, you're going to use releasing incisions, okay? But not in, you're doing that for, what did I just call it? Alveolectomy. You're doing that for bony exostosis. You're doing a alveoloplasty, a quadrant alveoloplasty. Now, in the realm of apical surgery, yeah, you might do a releasing incision because this was a papilla here, right? Like this. And you're going like this, and you're going like this along. You might do one vertical release, and you might open that flap this way to expose the apex to do an apicoectomy, which are pretty historic now in the days of dental implants. So to help you access something that's high up in the apex, I would say you could do a vertical releasing.
For impacted wisdom tooth?
Yeah, for an impacted wisdom tooth, we'll do vertical releasing incisions. Absolutely. For back here, might do that. This is here, like this.
Yeah.
Okay? You might do that, and then come forward too, and then this comes back, and then you can do like that, vertical release. But for basic dentoalveolar surgery, it's envelope flaps. So here's what we're going to do. We'll take out 30. We're going to take 1 papilla, and we're going to take 2 papilla forward. Okay? This is the embrasure space. Okay? And where are you going to go when you go to the second papilla? I like to stop mid-line angle, facial line angle of this tooth here. So we're going to take that. We're going to take this. You might consider this the marginal gingiva, right? It's not as keratinized as what's below. So that's what we're going to take. We're going to reflect that. Wide, long envelopes will preserve the integrity of the flap so it doesn't tear. 2 papilla forward in the posterior. Hupp doesn't talk about this in the textbook, but I do. In the anterior, I'm going 2 papilla back. Because if you flap the whole anterior and they have a high smile line, you might expose a CEJ. Or you might need to put a sling suture in to tug that tissue way, way down because it's not aesthetic if you're exposing the CEJ. So in the anterior, the rule would be 2 papilla behind and 1 forward. In the back, 2 papilla forward, 1 back. So here's the trick to a full thickness mucoperiosteal flap. Take your blade, and what you do is once you touch bone, you touch bone with the blade, you push.
You can try on this type
push.
of doctor. It's for perio.
Yeah, you can use the perio one. Sure, we have these. You go in here, once again, you push, 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 stay contacting it, okay? And then the number 9 molt. Then you'll put this into the embrasure space and you'll push, push, push. You might flip and pry, flip and pry. These are actually, I like these. Dr. Lonergan gave me a set of these, but I don't like to teach with them because they're not in the head. And this is tabletop teaching, but this is kind of nice for what we're doing. Thank you for bringing this. This is very good for that. So remember again, push, 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 flip, pry, pry, pry. But you're pushing down on the bone. I'll show you, I'll tell you why. If we do this from a side view, from a sagittal view, if we look at the flap itself, and this is the buccal, and this is the lingual, okay? And this is the flap, okay? And here's the alveolar bone, right? And here's